Good morning, good afternoon, and good evening, everyone, depending on where you are connecting us from. Welcome and thank you to those joining us live and to those who will be watching the recording afterwards. Please let us know by typing into the chat box from which country you are joining us from. My name is Özge Özer, and I am the Educational Partnership Manager. Next slide, please. Well, this is me, and I am welcoming you all to this great webinar today. Next slide, please. I would like to warmly welcome you to this 5th Academic Institutional Membership webinar. I would also like to welcome our speakers and our moderators, whom I'll hand over to shortly. Next, please. Angel Aurelian Cabeting, who is the FIP remote intern, will support us today to facilitate the event. Thank you, Angel. Next, please. Please note that this event is being recorded and also live streamed on YouTube. If you would like to rewatch it, you can visit our FIP's website. Please feel free to send your questions through the Q&A box and let us know which speaker should answer your question. We will be picking those up throughout today's session. You're welcome to provide feedback to webinars@fip.org. To become a member of FIP AIM, which is Academic Institutional Membership, you may scan this QR code and visit our website. Let's see today's program. Next slide, please. After I briefly introduce you FIP Academic Institutional Membership, Pierre Moreau, the AIM Chair, will do an opening speech about the webinar topic. Then we will hear the speakers' presentations. We have 4 valued speakers from USA and Egypt. After each presentation, a Q&A time will be made, so please send your questions through the Q&A box. At the end of the webinar chairs will wrap up, and then there will be some FIP announcements. Next, please. Let's see, next slide. Yes. This webinar is being organized by FIP AIM, which is Academic Institutional Membership. AIM is the only global network interconnecting schools of pharmacy and academic pharmacy leaders around the world for communication, collaboration, and sharing ideas around areas of interest related to academic leadership. It supports its members on various areas such as curriculum design and development, interpersonal education, academic leadership, experimental education and training, and so many others. I would like to take this opportunity and briefly mention some AM highlights. AIM has working groups that bring together the current and future academics to increase communication and collaboration between the AM members on areas of special interest. Currently, the AM group is working on strategies to improve enrollment in schools of pharmacy. Actually, one of the speakers whom you will meet shortly is one of the speakers today. I believe our FIP AIM chair will introduce him shortly. When you become an FIP AIM member, you may take part on these AIM working groups too. The next AIM working group will be on building academic capacity. Please note that various areas of concentration will be announced periodically in 2022. In addition, within this year, FIP will build World List of Pharmacy Schools. It is intended to guide all pharmacy stakeholders from students to policymakers. And this global list will be the most comprehensive and up-to-date list of pharmacy institutions from around the world. And AM members will have active and higher profiling power on this list. After you become an our member, we will send you a link to submit your school's profile. Also, AIM has a special careers page, and schools of pharmacy and pharmaceutical sciences with academic institution membership have the opportunity to advertise vacancies for staff, project leaders, and term positions to an international audience. Anyone, anywhere can view them on our website, but only AM members can post the career opportunities. Last but not least, Global Academic Leaders Forum is FIP AIM's annual meeting platform that takes place alongside FIP's annual World Congress each year. At the end of our webinar, I will announce World FIP's World Congress in Seville, Spain for this year, so stay tuned. At Global Academic Leaders Forum, there will be also World Cafe, where you will unite with all academic pharmacy leaders from around the world to discuss current and relevant topics on leadership and pharmacy education. In the light of these, if your institution is not a FIP academic institutional member yet, you may contact us at aim@phip.org and fill out the form that I will send you from the chat box shortly, and we will contact you as soon as possible. Next slide, please. And let's start today's webinar. Following the experience from the unexpected shift to remote learning and virtual education due to the COVID-19 pandemic, educators are faced with dilemmas of how to strike a balance between face-to-face meetings and the virtual platform. During our webinar today, we will share examples of hybrid models of teaching and discuss how to lead pharmacist faculties towards incorporating virtual education while assuring its quality. Let's see the next slide for Pierre. So now I would like to kindly introduce to FIP Academic Institutional Membership's Chair, Pierre Moreau from Kuwait University. Pierre is a great leader who is determined to advance academic leadership in all levels together with your support. And now he will give you an opening speech about today's webinar. Over to you, Pierre.
Thank you, Özge, and welcome everyone to this webinar. Of course, we are, getting out of this pandemic finally. FIP-AIM organized several webinars during the pandemic to try to help its members navigate through these adaptation and difficult times of shifting our education from on campus to online in a very quick and unexpected manner. And of course, we didn't always do that with the quality we wanted because we had to, again, adapt too quickly without having, a lot of planning. We had to do lots of experiments, sometimes using recordings, live sessions, Q&A sessions for students, demonstrations for labs. Even some placements that were done, remotely with patient cases sent by the preceptors. So many adaptations were done and we had to work around that. So FIP-AIM was at that time active in trying to provide best practice for these situations and help our members to face this pandemic. Of course, we had to learn to use several platforms like Zoom, lots of course jokes and everything, and funny videos on the web about Zoom meetings. Teams is another tool that was barely known before the pandemic, and now a lot of institutions have adopted Teams as a mode of work, and Moodles and others. And of course, this was used for teaching, but also for holding meetings, even thesis defense and other activities that were moving from on-campus face-to-face to a more online or digital approach. So definitely we had to learn a lot. Now that we are going back towards normal and we had this experience with these tools, we can, I think, and we should try to embrace this in a way that we can combine what we were doing before to what we had to do during the pandemic, so that we can really use these tools to their advantage and modify the way we address education, even management of our schools, so that we can take full advantage of the advantages of each approach. And this is what the objective of today, and this is what drove us to create this webinar today, is to bring together some people that would, reflected on that and could provide insight into how can we merge these two solitudes into one more effective and quality education for our students. So without further ado, we will start the webinar. Again, I'm very happy for you to be with us today, and I'm looking forward, like you, to hear about this webinar. So there will be two chairperson of the webinar. Both of them are members of the AIM Advisory Committee. One representing Europe, Lilian Azopardi from Malta, Dean of the Faculty of Pharmacy, University of Malta. I won't read all her credentials. You can read them for yourself because we have a lot to cover. But she's also the president of the European Association of Faculties of Pharmacy. So Lilian has a great leadership and is a great, let's say, member of our advisory committee. So I think Lilian had something to share with you. If we can have the next slide.
Thank you, Pierre, for the introduction, and it's a pleasure to be part of this team, looking at how we can move on with our education and leverage what remote platforms provide to us. And in the light of this, I would like to also connect with another activity that is coming up in May and invite colleagues to join us for the European Association of Faculties of Pharmacy annual conference, which actually bears the main theme of Pharmacy 5.0 education. And within it, there are sessions that are dedicated specifically to digital readiness from a provider perspective as an academic team, and also for our graduates, together with the expansion of competencies and innovating in the way how we are providing our education and our curriculum. So, therefore it would be a pleasure to keep on the discussion and have other examples being shared, especially for the European platform in this annual conference that is coming up, where we are also having an FIP workshop looking at a further focus on the digital tools and the digitalization of education. Thank you, and I look forward to this workshop today.
Thank you, Lilian. So for the next slide, I would like to introduce the co-chair of today's session, which is Dr. Hanan Refat from Egypt. So she's the Dean of the Faculty of Pharmacy at Future University in Egypt. Hanan is also a member of our advisory committee. You can see again her credentials. She's the editor-in-chief of the Future Journal of Pharmaceutical Sciences. She's coming from the field of chemistry, pharmaceutical chemistry, and she joined us maybe a year and a half ago, and again another very active participant at FIP-AIM, and both Lilian and Hanan agreed to chair this session. So I will leave it to them to guide you through this amazing program that they constructed. Thank you.
Thank you, Pierre, for the introduction, and it's a pleasure to be part of this webinar. Hello, my colleagues. I'm very glad to see participants from all over the world, and thank you for giving us some of your time. I'm also very excited to be co-chairing today's webinar with Lilian. Of course, we have gone through so many experiences during the online and the hybrid education while facing the pandemic. And of course, it will be, as Pierre said, it'd be very nice to share our experiences together with the urge to maybe develop our programs, and we should all take in consideration about what to include about crisis management. So I'm delighted to present our first esteemed presenter, Dr. Brian Hamstreet. He is Associate Dean for Student Affairs, University of Colorado. Dr. Hamstreet received his Bachelor of Science and Doctor of Pharmacy degrees from Alabama College of Pharmacy and Health Sciences. He completed residence in pharmacy practice and adult internal medicine at the Medical University of South Carolina. Dr. Brian, thank you for being with us, and the floor is yours.
Great, thank you so much. Welcome everyone. It's exciting to see colleagues from around the world and even a few of my USA colleagues that got out of bed early to join the presentation today. This is truly a topic that I know has affected all of us over the last few years, and I'm excited to share some of our experiences here at the University of Colorado in USA, because much like you all, we've been impacted and then are considering now how to proceed from a curricular standpoint with relation to next steps with our curriculum. So next slide, please. So just to provide you some context, with our program has traditionally been set up like a fairly traditional lecture-based program with some laboratories, including things like pharmaceutics, patient care simulation embedded within them. In the 2018 and 2019 timeframe, we were coming up on preparing for a curricular renewal. Our current curriculum had been in place since 2012. And with a pending accreditation coming up next year, we were in the process of revising. So the conversations related to remote learning and different approaches were happening already in 2018 and 2019 for us. As it turns out, those conversations became very timely as we hit 2020 with the COVID pandemic, which then forced all of us to work largely remotely. And now that we're back on campus, at least for our institution, we are now considering moving forward with our curricular revision and how we want to incorporate what we learned from teaching and curricular design over the course of the last 2 years. So currently our students are participating with an option to be on campus for the most part, or for attending virtually in some instances as well. And I'll talk a little bit more about that. I think one of the things to consider, as you all know, as we move into curricular design and considerations for remote learning, is just getting the nomenclature right. So the nomenclature, as you know, there's various definitions of what's considered electronic learning, online learning, remote learning, hybrid learning. Looks like we're going to reshare the screen, no problem. And then blended learning or high flex learning. So I think one of the things to consider as we move towards whatever changes you're making in the curricular realm in your institution is just making sure that everyone is understanding what the approach is and what the modality is that's going to be used. Just to use our own example at Colorado, the discussions were revolving largely around the ability to do blended learning model as our new kind of revised model as we moved into our new curricular revisions. What we're experiencing now is much like the high flex model, as I'll talk a little bit about, where students have the option of joining online, in person, or watching asynchronously afterwards, and then having some required on-campus activities as well. As many of you know, we are fortunate at our program that we've had a long-standing history of distance degree education. So we have separate, truly online programs for both international participants and North American participants, which is largely asynchronous and then incorporates some live events, such as small group discussions. So I have the unique opportunity to teach in all of those different programs. And so I have experienced, the online perspective, the hybrid model, and then now back in the classroom with using kind of more the high flex approach as well. I think what we've learned is one of the key pieces of this, again, is as you approach this for your program, is making sure there is clear communication amongst the various stakeholders. Certainly the faculty all need to be on the same page as kind of where we're going and what approach we are using. We utilize various faculty retreats, mini retreats, where we would meet, get together as a faculty, discuss options on how to approach the curriculum, get feedback from the faculty, incorporate that in there, and talk through what the potential challenges may be. So I would say, as many of you or your institutions, it's important to have open discussions and have everyone have clear communication on what the goal is for your curricular delivery in 2022 and beyond. And then certainly for students considering joining your program, they also want to know what they're going to get themselves into. So they want to know if they're going to be fully online, if they're going to be remote, if there's going to be a hybrid approach as well. And so this is important too. As Associate Dean for Student Affairs, I oversee all of our recruitment and admissions activities as well. So I'm frequently talking with students in what their expectations are and what they are now seeking from a curricular standpoint as well. So these are all important aspects of making sure that we have good lines of communication amongst the various stakeholders that are involved. Okay, next slide, please. Okay, so this slide shouldn't be too much of a surprise to all of you because I know we're all struggling with the same balance between learner expectations and the challenges of remote delivery. And so when we talk a little bit about learner expectations, I think we all recognize at this point, and this goes for us as too in our workplaces, that flexibility is one of the key aspects of what learners are seeking nowadays in relation to curricular delivery. So the ability to engage in the time frame and the manner that they wish to, but they also want consistency amongst those modalities as well. So if they're in class, they want to make sure that they're getting the same experience as they are if they're joining remotely or online. And then certainly efficient and easy to use technology. So in our institution, we use primarily nowadays Zoom as our delivery method. Our learning management system is Canvas. And so that's how we utilize a lot of our kind of course material delivery. And then as we'll talk about from an assessment standpoint, we use online remote proctoring and testing software as well, which allows the students to take their exams remotely as well. One of the things, as you all know, and I think Pierre mentioned this as well, is that as we transition to fully remote, there certainly was a learning curve for faculty on how to best deliver their previous course content in a remote manner. And to keep students engaged in the process as well. So one of the things we also did, which I think is important, and we'll talk a little bit about more, is share best practices as faculty experience the remote learning environment. And therefore, faculty that had teaching experiences coming up later in the curriculum could benefit from the feedback that they got from faculty and students, for that matter, on what worked well and what didn't. And then having good support as well. We're fortunate in our institution that we have access to an instructional design team who helps with our course delivery, structure, content, and online testing. And they were very, very critical over the last couple of years in working with our faculty to help get them up to speed on best practices related to course delivery. And then certainly reduce costs is one thing that we struggle with here in the USA, at least being in an area here in Colorado, in the Denver area, which has become quite expensive to live. Participating remotely has the potential to reduce costs and not having to live on campus or move to the state that you're currently in. Certainly, we'll talk more in depth about assessing the quality of education, which I know is a big concern amongst faculty and students, for that matter, that they are getting the same quality education as if they were previously when they are participating full time. Certainly technology, it's amazing to me that right now I can be talking to you all around the world in real time. So things like standard internet access and ability to have a computer and a location where you can participate remotely is a key aspect of having a good experience for both faculty and learners as well. We'll talk more about the different types of courses, and then learner engagement. So certainly one of the toughest things, and you all have seen probably a lot of articles recently in the literature about maintaining student engagement, which is very difficult to do in the online and remote format. And so we don't currently have required attendance for most of our courses, and therefore we're not taking polls for students who are in classes, but we can certainly get at that by incorporating certain activities into the classes to see how many students are there, and for those who are there who are engaging in the learning process. And that this goes again for well-being and socialization. Much like you all, our second year students in our entry-level program right now started our program the first full year remote, and then came back to our program full-time on campus as second year students. In the same manner, our undergraduate students that were transitioning into the first year of our program were joining our program back in the fall of 21 live as well. So both cohorts had participated largely 100% remote. And so we actually had to do two orientations, one for our first year students and one for our second year students, to get them acclimated to being back on campus and participating in real-time classes as well. Okay, next slide, please. So the biggest challenges I know we all faced was translating from in-person to virtual learning. And this had various aspects to it that I know we all struggled with. The big one being reframing what the students do from a preparatory time versus like virtual class time. I think initially what we learned is that many faculty were incorporating the equivalent of a full lecture into preparatory time and then having a full lecture's worth of class time or virtual class time, which was causing students to have an excessive amount of preparatory time in their classroom experience. This, as you know, is not beneficial when students are on Zoom and participating in the virtual format for 8 to 10 hours per day. And so one of the key aspects, I think, of considering this in many of the e-learning models or hybrid models have some guidelines in relation to preparatory time versus what we would consider in-class time, particularly if you're using a hybrid approach where you're then bringing students to campus to do on-campus activities. And then making good use of class time with active learning activities in class time so that the preparation occurs outside of class, but you maximize the time you have in class with active learning exercises that engage and apply concepts that the students are learning outside the classroom. And then as we'll talk about multiple modalities, this could be laboratory-based, different approaches, depending on the type of course that you have and the type of content that you're delivering as well. One of the things I think we all learned early on is, as Pierre mentioned, is utilizing previous course content from like the year or two prior was not a favorable approach from the standpoint of the students really wanted, at least initially, real-time engagement with faculty in the virtual classroom. So they felt like they were getting the experience of learning from that person with updated materials. Now, certainly a lot of this had to do with the short time frame and turnaround of going remote during the pandemic. And now more so, we are in the mode of making sure that any sort of our online materials that students are accessing prior to class are up to date and current. So students are operating with the current type of information there as well. Okay, next slide, please. So a lot of the challenges that I know we all experience, including coordinating logistics between remote and on-campus learners, needs for materials and equipment. I know many of you have classroom activities that require physical either materials that students now don't have access to in the remote environment. Simulation and standardized patients. So simulation is a little bit more difficult to do because if you don't have access to an in-person simulation lab, then trying to translate those activities to a virtual format is a little bit more difficult. Now, as it turns out, we have a simulation lab on our campus, and our standardized patients we use do participate in our virtual activities as well. But again, it's not the same as being there in front of a patient as if you were in person as well. Need for practice with adequate feedback. We try to incorporate as much formative use of information in the curriculum so that students are prepared then to go into their formal assessments, having practiced the material and being comfortable, particularly with the verbal types of activities that we do in our curriculum, which are very different if you're doing them virtually instead of in front of a patient or a faculty member. And then transitioning all of our resources, we are fortunate that our campus has access to library-based resources from textbooks, and we upload all of our, again, course materials to our Canvas learning management system. And so students don't have too much of a problem accessing what they need from a curricular content standpoint. As many of you know, it's been challenging, including our own, to deliver courses like Pharmaceutics, which require preparation and demonstration. And I've put a recent article in here for you all that references some recent efforts to translate these classes to virtual, where students can be participating in real time or asynchronously using materials that they may have at home or materials that are sent to them to then do these preparatory type activities and participate either in real time or asynchronously. So one of the big challenges, I think, from a faculty standpoint was getting a handle on, I've done this laboratory traditionally in person, how can I then translate that into a virtual experience, which I know many of you have also done as well. It's a little bit more challenging, but again, use of technology like YouTube has become quite popular, and then use of video-based instruction as well. And then teaching effective communication skills. You and I are all conversing right now virtually, but certainly interacting with patients and other healthcare professionals in real time in person is an important aspect in competency that we want all of our students to come out with. And so making sure that our communication assessments in particular are in alignment with what we would normally do for those students when they're on campus, which again is challenging. Okay, next slide. So one of the things that we are fortunate to have in place already when the pandemic hit was online virtual testing. So we use online testing with a remote proctoring remotely, particularly multiple choice exams, some essay components to those as well, and then case-based components as well. So from the standpoint of lab and practical exams, this is where the challenge again came in. I provided a reference on the slide here from you all as well from our program that was recently published, where we converted our OSCEs exams that we were doing at the end of each academic year for our students to virtual formats. And so this again had the decision to translate all the in-person activities to various online activities, some of which were live and synchronous, and some of which were translated into multiple choice format as well. So I'd encourage you to take a look at that. Overall, it worked well, but again, it was a lot of logistics associated with it as well. Group projects, as we know, a lot of our students like using the format of the breakout rooms. However, we found that many of them were breaking out of the breakout rooms and using their own kind of group chats during those exercises as well, which was pretty interesting. And then we use eValue as our e-portfolio learning system for our co-curricular aspect of our curriculum. And then again, our instructional design team has been heavily involved in helping our faculty with our online testing procedures and designing courses as well. So again, capturing the co-curricular aspects during remote learning is important as well, because we want to make sure those students are meeting those competencies and getting those experiences and that they're captured. Okay, next slide, please. So certainly exam integrity is a big one that we all worry about from the standpoint of remote learning and assessment. And so again, we use a virtual proctoring software, which requires students to do room scans, show their learning environment. We incorporated alternate camera views where they're not just using their forward-facing camera, but maybe a side-facing camera to make sure that they don't have materials that they have access to outside the view of the camera. Screen sharing, so some of our exams that involve case-based discussions, we have them share their screen to make sure that they're not accessing materials on their screen. And then one of the interesting things we've encountered is some students, as they're going through, and we, during our exam process, video all of our exams, and some students like to verbalize their questions as they're going through and read them out loud. And one of the things we worry about is whether or not those attempts to do that are communicating or attempts to communicate information to other students. And so this has changed some of our exam integrity procedures around delivery of the exam as well. And then making sure we're writing new questions like we do every year to make sure that the exam content is fresh and that it minimizes the integrity aspects of questions being out on the internet somewhere or shared amongst students. One of the ways to get around this again is to incorporate frequent low stakes or formative assessments like quizzes, which we do in our program, where the incentive to participate in academic dishonesty is low because the stakes are low. And it's really geared towards practice and learning. And then our skills focused assessments, again, having the students be able to participate in real time and assess them in real time. Those are not knowledge based, and so they actually have to demonstrate the skill, and therefore there's lower sense that they'll be able to participate in an academic dishonest based assessment. Okay, next slide, please. So one of the things that we've done, much like you all have, is determining what our markers of success are going to be for our curriculum. So certainly we're looking at pre and post-pandemic assessment and evaluation performance for exams, which we've had fairly equivocal performance for most courses as well. And then getting a lot of feedback from students and faculty. So in my position, we meet frequently with our student officers and our students to make sure that their experience is indicative of what they feel is appropriate, and that if there's troubles or things we can troubleshoot, then we can get on it early, make the changes, and then the experience is better for all the students in the class. Early intervention in my office, we reach out early to students and course directors to make sure that those struggling students are identified and that we intervene with things like tutoring for those individuals. And then I mentioned that sharing of best practices amongst faculty is key. So as faculty find things that work, sharing those amongst the faculty is important to make sure that the students get on not only a consistent approach, but are utilizing their time appropriately with methods that are going to be maximized. And then one of the things we're all considering, ourselves including, is if students are unsuccessful, do we have to participate in remediation processes, which adds extra time and workload to faculty as well. And so we did some remediation over this course of this past year, which was fairly intensive, as we found some students' learning approach was not maximized by the participation of virtual learning. So I'll be happy to talk more about that if we need to. Next slide, please. All right, I just wanted in the last couple slides share our experiences with one unique thing we did last year based on the feedback that we received from students, particularly related to the preference for remote learning. We embedded a remote cohort within our entry-level program. So our entry-level program has about 100 to 110 students in it. Last year, as driven mostly by reductions in costs and increases in flexibility, we admitted 11 students from around the United States into a remote learning cohort. So they were eligible to participate in real time via Zoom in classes, and then come to campus twice a semester for 1 week at a time to participate in live on-campus evaluations and course activities as well. So this was truly along the lines of more of the high flex type model as well. So next slide, please. And then the considerations we learned from this process is the timing of travel. So as students from around the country, we had students from all over the continental United States. It was very important from the timing perspective. Many of them were traveling long distances to make sure that their class time was not interrupted too much by travel. And so initially we had them traveling during the week, and we switched that. So now they are traveling over the weekend. And then trying to organize and schedule activities with course directors and student organizations while they're on campus to be in alignment and maximize their experience while they're here. We do in my office frequent check-ins with our remote cohort as they are participating in real time. We also want to make sure that they're staying engaged. We ended up having a dedicated tutor just for this cohort, so they felt like they were getting the same experience for those on campus. And then the impact on our courses would be that each of us that are teaching in the classroom have to have Zoom pulled up for the cohort to be participating in real time and be responsive to their questions and input as well. All right. So along those lines, I'll leave you all by just saying that this model, if you're interested in more about it, has worked well. We've learned a lot from it. The take-home message is as we incorporated live Zoom into the classroom with just the small cohort of students, it became very evident that the remainder of students in the classes wanted that same experience. And so we opened up most of the courses, the Zoom link to most of the students for the courses, and now they largely participate via Zoom or come to campus based on their choice. And so it's truly along the lines more of the high flex model. I think that's it for me at this point in time. I think we have some time for a few questions before we move on to the next speakers.
Thank you for this amazing presentation, Brian. I'm sure many our participants have taken notes from what you do in your school. I have been checking the Q&A box along with our panelists and speakers, and we have some questions for you.
Okay.
The first one is from Onyeka. Onyeka is asking, the assisted translation of class notes and instructional materials to online formats, did lecturers have support from developers, and how can one adapt in an environment without support?
Yeah, that's a great question. So because our learning management system that we utilize, most faculty were already uploading course materials to that learning management system that students accessed online anyway. And so it wasn't too big of a shift to get those materials to the students because they were already using that. I think the bigger issue was translating those materials to a format that was more conducive to virtual learning. And that is where indeed our instructional design team came in helpful, where they could work with the faculty to make sure that not only translated well, but then faculty were spending the appropriate amount of time on course materials and preparatory materials for classes as well. If you don't have that support, then I think looking for examples from around the world and from your colleagues is important. There's a lot of things published now on experiences in the COVID learning environment, in particular of what works best based on the format that you're considering using. And so it is a difficult task. I can speak to myself included of having to translate my materials as well. We had the benefit again of teaching in distance degree programs and online programs for many, many years. So it wasn't that big of a transition, but I think just being mindful of the differences in learning that may be experienced and the timeframes associated with those. And then via Zoom, as we all know, some approaches that you would normally do in class may not translate all that well to virtual format as well.
Thank you, Brian. I think it explains perfectly to Onyeka's question. We have many questions, but I think during the webinar, you may take them out from the Q&A box. So please feel free to send your questions throughout the webinar. Just one last question from Philippines comes from Pearly. Pearly writes, in the Philippines, we gradually transition to in-person teaching and learning modality. The challenge now is that the students prefer virtual approach For some reasons, while based on the survey conducted, in-person modality is more effective than online learning. Any thoughts on this?
Yes, Pearlie, I'm right there with you. We are experiencing the same thing in the United States, and our program in particular is that I mentioned that once we made the decision to open up Zoom links to the entire class, that the majority of the class does prefer to be online and participate virtually versus come to class. So this really begs the question of, we have some faculty who feel strongly that requiring the students to come to class because they feel the modality is more effective is the appropriate approach. And that has gone okay for some classes, but not all. And so I think designing your course and setting expectations for what you want to achieve in the course, and if you do want students to be in the classroom, structuring the lessons in a manner that is more conducive to in-person learning is probably the best approach. I can attest to the fact that, having taught early this semester that, the majority of students were online. And so I do things like incorporate polling questions, patient cases, and I use some other technologies like Kahoot, which many of you may have used, where you do real-time surveying of the students to keep them engaged. And that then translates to both the online students and the in-campus students having the same experience, and hopefully the outcomes being the same as well. And so it is a challenge. And I think, as adult learners, our students have the choice now of to come to class or not. And I think it's just making the best use of time, whether they're there or online.
Well, thank you, Brian, and thank you for our moderator, Hanan, for this great session. And now I kindly ask you to check out the questions from the Q&A box. So I encourage everyone to write all of your questions here while we found Brian here. And next, we will move on to other speaker. We are with you, Lillian.
So thank you, Brian, for that smooth introduction into the topic. And now it gives me great pleasure to introduce two colleagues from the College of Pharmacy of the University of Illinois at Chicago, Professor Allen Lau, the Director of International Clinical Pharmacy Education. So many of you on the webinar may have worked with Dr. Lau in the remote environment with regards to clinical pharmacy in education programs. And Professor Lau is now also the International Program Director for the American College of Clinical Pharmacy. And I welcome Professor Lau. And the second speaker in this session is Professor Jennifer Pham. She is a clinical associate professor at the University of Illinois and a practicing clinical pharmacist with a specific practice in neonatal intensive care unit. And Professor Lau and Professor Pham will be sharing their experience of the extent of remote learning, with a particular focus on internationalizing our academic programs across different parts of the world, and also with a focus on having how to mobilize the academic team to have a remote experiences and learning even for the experiential part. So on to you, Professor Lau and Professor Pham.
Thank you very much for the very kind introduction, Professor Esopati. I also have to thank FIP AIM for this opportunity for myself and also my colleague, Dr. Jennifer Pham, to share our perspectives and experiences. The University of Illinois Chicago College of Pharmacy has a long history of our international clinical program that was started about 40-some years ago. The purpose is to work with our partners to advance global clinical pharmacy education, practice, and also research and scholarship. We typically work with our global partners to facilitate the effort on developing or enhancing academic degree programs. And also at the same time, we provide training and education opportunities for faculty, pharmacists, and also preceptors to enhance their teaching skills and also clinical and practice skills. Next. Next slide. Typically, a lot of these collaborative programs involve our faculty going to host countries and also for faculty preceptors coming to Chicago for clinical education. But because of COVID-related international travel restrictions, that has to be suspended for the past 2 years. So instead, we have been conducting quite a bit of virtual teaching and education through Zoom or other technology so that we can continue our collaboration on didactic course, academic program collaboration, and also providing clinical teaching for APPE students, and also continuing professional education. Next slide. Next slide. So with the University of Malta, since 2014, we have been working together on this Doctorate of Pharmacy degree program, which is a EU level 8 programs with a fine balance between research scholarship and also clinical practice. And the purpose of the program is to prepare practitioners or pharmacists being able to practice in a variety of practice settings and be a leader to initiate changes in whatever setting that they have, whether or not it's a clinical scientist or practitioners or educator. Next slide. In the collaboration, we share our teaching that we use for our own PharmD students to students in the Malta program. Specifically, is a therapeutic sequence, which is a 10-course sequence dealing with therapeutics in different areas or specialties. And the last one is advanced disease management, dealing with complex patients with multiple conditions and diseases. We also share or work together in teaching drug information and evidence-based medicine, pharmacoeconomics, and also health system in the United States. Next slide. In each of these courses, we share our recorded lectures that we use for our own PharmD students, for students in this collaborative doctorate program. And then our faculty conduct live weekly case discussions or discussion of topics by Zoom, so that there would be live interaction between the faculty and the students. And then our faculty would also periodically visit Malta to teach and to meet the students in person. And some of the students would come to Chicago for clinical rotations. And then we also provide opportunities for research collaboration. Next slide. Since 2014, at this time, we have graduated about 65 pharmacists already, with the 35 in the program right now. Altogether, there are about 100 representing pharmacists from about 20 countries in different regions of the world. Next slide. So now my colleague, Dr. Jennifer Pharm, will share our experiences in delivering clinical education for EPI students with our partners. Dr. Pharm.
Next slide. Thank you so much, Allen, for the introduction. So before I begin, I would like to thank FIP for inviting me to speak at this important webinar on virtual pharmacy education and clinical practice. Today, I would like to share with you how clinical API rotation was delivered virtually to one of our international partners and experience with the University of Santo Tomas PharmD program. Next slide, please. So with this program, before we developed the program, we met with the team. We met with the dean at the University of Santo Tomas, as well as other preceptors and faculty to have a better understanding of the students' education and the needs for the API rotation. So after several meetings, we decided on the following. So it was a 5-week API rotations per module, and that we will take 2 modules a year. And this actually started in the fall of 2020, right at the peak of COVID-19 pandemic. There were 30 students, APPE students, of which at that time, we only had 2 preceptors. It was very difficult for us to recruit more preceptors at that time, since we as faculty also have to remodel our old didactic teaching, as Brian mentioned earlier. So our faculty had a lot of other teaching responsibilities that we were not able to recruit. So keep in mind, each preceptor would have 15 APPE students at the same time. Initially, with the first module rotations, we met with the students 1 time a week for about 2 to 3 hours. But after that, our student provided us feedback and saying that they would like to have more exposure. So then we went up to 2 times a week for about 2 to 3 hours each time. All our virtual APPE was delivered through WebEx, and we felt that was a more secured, HIPAA protected at our university. We were not allowed to use Zoom at that time. Next slide, please. So initially, with the first module, we learned there's a big learning curve. Most of the time, student from UST was more of an observer. They did not really participate that much, and there was some reason for that. So initially, how it does is they would observe my student present patient cases, and a lot of time, UST students were not able to participate because they did not have access to our patient electronic medical records, so they're not able to view the patient beforehand. They also try to participate in topic discussions, but a lot of time it was difficult to ask them to participate, again, based on the lack of knowledge. We realized that UST student had not done a journal club, so I made my student perform journal club presentation during one of the meetings with our UST students, so there would be have more exposure on how to conduct effective journal club presentation. However, we realized that we would have to have some accountability and evaluation of the UST students. So initially, we started out with simple tasks, simple activities. We provided them a drug of the day that they have to present, and then we led on to a more comprehensive disease state, focusing on pharmacotherapeutic part of it. We also have them attended pharmacy resident and physician seminars and topic discussion, which is a little bit more complex cases. And I felt that that was important for them because then in those seminars and topic discussion, they're able to understand how to critically assess the literature and hopefully apply them to clinical practice. Next slide, please. So we realized that during that first 2 modules, like I said, it was a big learning curve, recognized that there were some challenges. So like I mentioned earlier, because UST student did not have access to our patient electronic medical record, they were not able to understand or follow when our students are presenting independently. They're also not able to work up independently and also proactively identifying problem lists like the expectation I would expect for my APPE students. Furthermore, UST students did not have any IPE exposure as part of their pharmacy curriculum in their curriculum. Hence, they lacked the ability to assess patient effectively or understood what to look for when they are reviewing patient's chart. As I alluded earlier, UST student did not really participate in much of the discussion. There was either patient discussion or topic discussion, and this may be due to several factors. There was definitely an inconsistency of pharmacy education among the UST students in the programs of pharmacy programs in the Philippines. And also I recognize that there's also a lack of clinical knowledge among the pharmacy students, mostly related to the lack of pharmacotherapeutic courses within their PharmD curriculum. We realized that there's also some cultural differences. You know, I travel quite a few teaching different countries, and I realized that particularly with the Asian countries, students are quite shy to speak up, and not necessarily because they don't know the information. There was also some environmental factors. Some of the students did not want to turn on their camera, which is expected from them, or their microphone. And that's because there was, at this time and until now, students at the University of Santo Tomas is still doing everything remotely. So there was just a lot of background noises in their home. Next slide, please. So to combat a lot of these challenges, I decided to revise the APPE rotation to better fit the students' needs. And so first, like I said earlier, since they did not have access to our patient medical record, we email them the patient cases beforehand. So either my student will prepare the case that we're going to discuss, or myself will send it to them a few days ahead of time. That way the student will have a better idea of what we will be discussing, have time to review the information. I also mentioned that there was a lack of inconsistent or lack of clinical knowledge, especially within the pediatric pharmacotherapy. So I decided to provide them several lecture series on major common pediatric and neonatal disease states. I also use a flipped classroom assignment or model in which the students are given the assignments ahead of time with some reading material so that they can work on the material. And then the following week, we would go over the assignments and then provide them constructive feedback. I felt that it really worked well and they really liked the time to do it and that we're able to provide feedback after that. So at this time, students also had an opportunity to perform journal club presentation and also more controversial topic presentations since they were able to observe some of these activities with their previous rotation. Next slide. So some of the assignments, or sample of the assignments that they do, and they really like it, maybe they just like numbers and calculation, included a pharmacokinetic assessment of aminoglycosides and vancomycin dosing in pediatrics. We talk a lot about parental nutrition and fluid electrolytes, so they're also giving those assignments as well, and that I'll give them feedback after that when we meet with them in person. Next slide. We realized that we encounter other teaching obstacles that were well beyond our control. So one, a lot of times unexpected patient care issue arise in the middle of the day. So oftentimes I would have to attend to a medical emergency response to one of my patients. So I would have to leave the teaching session. So luckily I had my students and my residents to continue the teaching activities with them. We also experienced some unreliable Wi-Fi access for our students. And oftentimes we realized that the Wi-Fi was really weak when they show their cameras. So in those students, we asked them to not show their camera until they're about to speak or present. We realized that teaching international, this is encountered for everyone and not just specific to the Philippines, that there's different drugs treatments. And to combat that problems, the students have never been on rotations. Most of them have not worked in a hospital. So it was very challenging to not only recognize what drug they have, but what drug treatment therapy they use in their local institution. One of the biggest complaints by our UST students were the timing of our rotation, because we have a 13, 14-hour time difference depending on the year. The students would meet at 4 o'clock in the morning or 5 o'clock in the morning, which equates to about 2 p.m. Chicago time. So it was a little difficult for them. We also have to be aware of social and HIPAA, because a lot of time we have to make sure that we did not perform or identify any patient identifier, because our teaching, so that we have to make sure that that was being protected. And as I alluded earlier, one of the biggest concern was our preceptor availability. At that time, we only have 2 preceptors, each preceptor taking 15 students at the same time. So as you can imagine, the learning is not really tailored to individual learning goals and objectives. Next slide. And we also realized there are just challenges with virtual teaching. And I think Brian alluded to some of this, and this is, but regarding to clinical, this could be virtual teaching for my student when the first for several months of our rotation was remote. So as you can imagine, when you're learning everything remote, it's difficult to hear them, loss, and then leads to loss of a lot of pertinent information. Even our student remotely were joining in rounds. It was really difficult. I also found it was very difficult for me to assess the student comprehension and knowledge of that material that's being presented. And there was definitely a decrease in student engagement. And this may be due to multifactorial, either lack of knowledge or the virtual learning itself, that you're not next to them, asking them questions in front of them. Students perceive preceptors as role models, mainly by observing what their preceptor do, right? So a lot of time they like to observe how we communicate with the medical and nursing staff. We like to do a lot of hands-on experience at the bedside, or even doing some bedside teaching. So I felt like a lot of the role models of pharmacists and preceptor was lost with virtual teaching, Because before virtual teaching, my students now, what they do is they would come and do hands-on experience with this calculation at the bedside, talking to our nurses, and you lose a lot of that teaching, clinical teaching, when you have virtual learning. Next slide. So before we end, we felt like, for future improvements with any of our international partners, we realized that we need to provide them some background didactic courses to our students before the API rotations. We are also hoping to see if our student can have access to our electronic medical record so that they can evaluate patient independently and join virtual rounds. However, we felt that if that was not possible as part of our hospital administration, perhaps the institution can purchase this great educational platform called Electronic Health Record Go. We also use this platform for our first and third year students, where it's have a bunch of patient cases, real life cases, and the students can somewhat mimic that clinical activities. My hope is to increase preceptor availability, so recruiting more preceptors, and that way it will be more tailored to the student individual needs, and that we're hoping to modify the evaluation forms to align with their goals and objectives, but also make it workable for our preceptors. Next slide. This is just an example, one of my 15 students and also a UST faculty joining on one of our discussion. Next slide. This time I'll leave the table to Allen to discuss continuing pharmacy education.
Next slide, please. So as part of our international collaboration, very often our faculty will travel to the host countries to conduct workshops, training programs, or participate in conferences. And then at the same time, faculty, preceptors, and pharmacists come to Chicago for clinical education. But then because of COVID pandemic, all these have to be suspended for the past 2 years. Next slide. So instead, we have been conducting quite a bit of teaching online. And it is interesting to know that online opened up a lot of capability that we were not able to do before. Example is that we had several programs in China. And in each of these programs, we had more than 10 or 20,000 pharmacists participating. That is an amazing number that we never thought that we can reach out to so many pharmacists in one single event. Next slide. We also have been conducting more intensive program for some of our partners. One example is this advanced internal medicine pharmacotherapy program, which is quite intensive for a smaller number of pharmacists. Our purpose is not to just have another collection of pharmacotherapeutic lectures. Instead, we want to emphasize applications, development of clinical thinking, clinical skills, and also practice skills. So how to use our therapeutic knowledge to apply to patient care. So for us, we have been using our pharmacist faculty, teaching pharmacists, so that we can share perspectives, share experiences, and offer practical suggestions. At the same time, we can provide encouragement and also reinforce some of the significant or important practical professional value. Next slide. So you can see that this is a very intensive program. It's offered over 2 one-week blocks. And every day we have 6 hours of teaching, 6 days in a row. So in other words, we have about 70 hours of contact hours over these 2 weeks. So because of the time difference, it's actually quite a challenge. We in Chicago have to teach in the evening until around midnight. And pharmacists from Hong Kong and Macau have to start at 7 or sometimes 6:30 in the morning until 1 or 2 p.m. So in these 2 periods, we were able to cover 52 diseases or therapeutic topics. And then we provide opportunities for the participant to present cases that they've seen in the respective practice setting, so that our faculty can provide feedback and also stimulate clinical thinking, and hopefully share how we can impact the care of these patients in a real life setting. At the same time, Hong Kong physicians would share their perspective additionally outside of all these 70 hours about how they manage patients in these type of diseases, so that the participant would learn the physician's perspective. And then at the end, there's a 2-hour final examination to make sure that everybody attains certain minimal competency. Next slide. At the end of each day, there's a so-called wrap-up or local application session, in which the program directors and maybe a few of our faculty would meet with a group of about 30 pharmacists participating in the program. And that meeting is not meant to be therapeutics in nature. We pause and reflect what they have learned in the past 6 hours or so, and put it in some practical perspective, and see how they can apply in the respective settings, maybe perhaps start new services or change the way that they practice. And that would also be a forum to share successes, ideas, and then it would be a good networking opportunities, both locally and also internationally. And initially, we were quite skeptical about how much participation and engagement that we can see in this virtual teaching environment. But surprisingly, there has been a lot of participation, questions, sharing through chat box, and also verbal engagement. Next slide. So for this program, we were able to engage 36 faculty from Chicago for this 2 weeks program. And it were not because of the virtual teaching. It would be impossible to send 36 faculty to Hong Kong and Macau to do this intensive program. So it really, virtual teaching opened up a lot of possibilities for us. Next slide. Next slide. So with the COVID pandemic, it forces us to stop doing what we have been doing. It gives us time to reflect and also think about what we have been doing, how we did it, and also give us time to almost start from scratch and provide us opportunities to innovate. So down the road, we hope that we can apply this type of teaching to more different types of programs, to more of our partners. And we hope that more of our faculty can be participating in teaching, working with our international partners, not only through APPE, but for continuing professional development. Again, we don't want to just give information. We want to promote critical thinking and also the development of clinical and practice skills. Again, thank you very much for this opportunity for me and Dr. Pharm to share some of our thoughts and experiences. And I look forward to having more engagement with many of you and hopefully see many of you in person. Thank you.
Thank you, Allen and Jennifer, for this great information. I'm sure many of our participants are digesting all this great information, and what a great dedication that you have for days and nights. You're working on to advance our profession, and it's amazing. Thank you very much for sharing this great experience with us. Lillian, shall we look at the Q&A box?
Yes, I have seen a particular question that Allen and Jennifer may want to explore further, which relates to how the difference on the challenges among students coming from different years, or their exposure to practice that they already have, how you see that one can overcome such a challenge with different experience of students.
Yeah, I think Jennifer would be the best one to answer it. We have a short time left. We would like to have Saif to present. Jennifer, you already mentioned that some Asian students were uneager to open their cameras or answer the questions that they don't know the answer. So what about the students, considering what year and what subject they currently have? What are the challenges that you saw and how to overcome it?
Thank you for the question. Yes, I already saw we've done it 6 times already. So now every time we do it and we modify it, I notice the students are talking more. And I think a lot of time we just have to make sure that we want our students to succeed. So that's why we have to change the model, that we have to give them some background knowledge because we cannot assume that they have the same background. For particularly with the University of Santo Tomas, those are all PharmD students. So they are at least, they're not first year, they're not second year, they already got their bachelor. So they're already advanced. But even with that, we just want to make sure to streamline that they're aware of pediatric pharmacotherapy, which I know is not that taught well in any curriculum, even in the United States. So I think that I already saw a huge progress and the students are a lot happier. They actually have more work to do and they like the work to do because they have a whole week. We only meet with them a couple of times a week. So they have a lot of time to work on it. And I think that the work that they provided has also immensely of higher performance.
Thank you. Allen, do you have any comments to that question? Or if you like, you may proceed to answer them in the Q&A box. There are some questions for you and Jennifer. Okay, I'm seeing a nod. Thank you very much to you both. And let's continue. We're back to you, Hannah.
Hello. Now I would like to thank Allen and Jennifer and Brian for their interesting presentation, really. And now for our last presenter, Dr. Saif Al-Hadidi. He is a lecturer of clinical pharmacy in Future University in Egypt. Dr. Al-Hadidi is also Task Force Silver Member and Heart Failure Specialist of Tomorrow at the European Society of Cardiology, ESCC, Heart Failure Association for Digital Health and Education. Professor Al-Hadidi brought his PhD from University College Cork. Saif, welcome, and the floor is yours.
Thank you, Dean Hanan, for the kind presentation. I'm really happy to present today in this prestigious event. I'm going to be talking about lessons we learned from COVID impact on education with the focus on FUE as showcase. So as you may know, that there are 2 models of education which are face-to-face, the traditional way or the didactic way of education, and the digital education or the virtual education. So from previous and from literature before COVID era, both types of literature are equally effective in terms of knowledge delivery, skills learning, and behavior. However, so digital learning and traditional way of learning might be more effective and more efficient when used in blended format in terms of explaining and procedures. Next, please. Next, please. So what is the definition of a blended education or blended learning? As you heard from my previous colleagues, is the combination of the traditional ways of education with the digital formats and the digital outlooks of education and mobile learning. So this type of learning will result into different delivery formats, into different forms of communication and innovative didactic models of education. Next, please. So here's a meta-analysis, a recent meta-analysis published in 2021 showing the difference between the traditional way of education and a blended learning. So as you can see here, that the pooled effect of 18 qualitative and quantitative studies running a comparison I'm sorry, running a comparison between comparison between traditional and blended learning has I'm sorry. This meta-analysis has shown that blended education has a large effect in favor of improving student knowledge in comparison to the didactic way, even when they included the randomized controlled trials. Yes, the effect was moderate, but still in favor of the blended education. Next, please. So here's another point of view for blended education, and we can see here the significant difference of blended education that seen in 4 studies in the aspect of improving student skills, and this meta-analysis showed the significant benefits of blended education over the traditional ways of education. Next, please. So we can say that blended learning is the big umbrella that can help the instructor or the teacher to implement the different ways of education communication as asynchronous or synchronous education, live and virtual. Also, blended learning help the teachers and instructors to implement their different teaching philosophies like behavioralism, cognitivism, constructivism, and connectivism. So next, please. As you can see, for example, some blending options that can be applied in behavioralism. So you can apply online training and testing followed by skills lab. Next, please, as drill and the practice. Next, please. So if you are concerning about cognitivism as your teaching philosophy, where the students obtain knowledge, so many blending options are available as multimedia presentation, concept maps, infograms, hyperlinks, and patient simulation cases. Next, please. Previous one, please. Previous one, please. Yeah. For constructivism, so we have synchronous and asynchronous communication, wiki and WeBlock. Next, please. And for the last teaching philosophy, which is connectivism, where the students create their own connections and develop their own network, there is many blending options like the use of internet, Wikipedia, podcasting, and instant messages as WhatsApp in some educational courses. Next, please. So there is a primitive and very elementary question. So is COVID the good guy or the bad guy? So yes, it's very primitive questions, but actually we can see another side for COVID. So there is no doubt that COVID had adversely affected our everyday lives on all aspects, our work environment, our social events, and posed a serious challenge to our healthcare sector and education sectors. And for sure, pharmacy learners, preceptors, and practicing practitioners have been adversely affected and suffered of a certain change in their everyday practice and tasks. Next, please. Here's a very nice study from New York City, data from around 1,000 participants. And I know that my previous colleagues were talking very well about many American experiences. But in this study, we found that 15% of the New York learners were forced to relocate, with 4 of them becoming homeless, 30% of the learners had the inability to go to their university or training locations and were forced to withdraw from their registered courses, and 90% of learners had difficulty in concentration and following up with their courses. Next, please. So actually, yes, COVID has very bad impact on our everyday life and on many sectors, but we have to say that COVID created a golden opportunity to accelerate and escalate the digital transformation and accelerate the digital education and the novel delivery of pharmacy curricula, in particular in the low middle income countries and Africa and Middle East. Next, please. So Africa and African countries, like many other countries, have designed and introduced very strict measures to combat COVID. However, these strict measures were exacerbated by the lack of quality infrastructure and the lack of experience with the sudden digital education implementation at the start of the pandemic. Also, there was a big challenge about the cost and reliability of internet access among Africa and Middle East. Next, please. So here's a very nice screening survey about challenges that met Africa during the pandemic era. And we can see, for example, that nearly all the 5 regions of the continent were facing a challenge to transfer all courses from the paper format to the digital format. Also, in some areas in Africa, like Southern Africa and Western Africa, there was a problem to teach the staff members the needed and the basic skills for IT, for the delivery of the e-learning or digital learning. Also, we can see that nearly in all the country, there was a problem with the cost of internet and the reliability of a good internet connection to have a scholar day of 7 to 8 hours. Meanwhile, actually, we can see that some practical courses have been stopped or didn't work well during the era of the COVID, despite the rapid adaptation and the rapid change into the digital education. Also, we can see that some regions in the continent faced many problems to get positive feedback from the students or to have a consistent communication with their students. Next, please. So how did FUE think of this challenge or crisis? So FUE strategy had main pillars. So the first, how to maintain communication, how to maintain faculty engagement, and also it was very important that the top management of FUE were very open-minded and allowed the juniors to think outside the box and suggest all the potential solutions to overcome this crisis. The fourth pillar was how to provide the important and the basic resources and tools to deliver the curricula in the most optimum form despite the crisis. And last pillar, and not least, was to create a certain sense of accountability and timeline for each task involved in the education process. Next, please. So here is one of the response of FUE during the lockdown. So for example, all courses within 3 weeks were transformed from paper form to online form. Also, many sessions and hands-on workshops and WhatsApp groups were created and held over a very short period to teach the staff members and associate staff members the information technology skills regarding Zoom and regarding also the LMS model at FUE. However, despite the big effort exerted by the university, there was a major challenge about the internet, because there was a difference in the reliability and cost of internet inside Cairo, the capital of Egypt, and outside Cairo. So as we can say that the internet quality was going less outside the capital. Actually, regarding the practical session, there was a shift to virtual hospital and evening podcasting and some sorts of online gaming in some courses. Yes, we did a rapid and quick adaptation to the digital learning, but we have to acknowledge some drawbacks. So regarding the communication and experiences, so there was a conflict between the students' opinion as resistant or supporting the idea of pure online education. So on the level of safety measure and security measures for student assessment, we did around 2 up to 4 quizzes per month. However, we couldn't apply a robust security measures for students' examination and assessment check for some culture issue. We had the software for room screening and room scanning and student scanning before and during the exam, but the idea was rejected due to certain culture issue. Next, please. So what did we do after the initial ease of the lockdown? We started to implement some sorts of blended education in many courses, yes, many and frequent adjustment of the academic calendar and many many changes in the timetables. And here I have to thank the dean and the vice dean, because they did a very great effort in this logistics. Also, the staff members did a huge number of exams makeups and rescheduling for the exams due to the cases of COVID infection. So now we are back to school by a percentage of 100%, but previously we were returning gradually as 25%, then 50%, then 75% of our full capacity. Regarding our practical and experiential learning, unfortunately, it was stopped over the last 2 years, and this semester was the first where the students can meet and contact patients directly. Before the ease of lockdown, it was only a virtual discussion and virtual sessions or even recorded meetings. So as a response or as a way to improve the practical sessions in the COVID period, so all practical courses included engaging and interactive videos and different exercises to increase student engagement. Next, please. So here's an important SWOT analysis for our blended education. I have to focus on some strengths, like, for example, our current strategy helped to serve many students in a very short time. Yes, we are now connected both in and out of class. I can say that all staff members and associate staff members have the basic IT skills to run physical and online courses. Now the top management are highly committed to implement blended education formats. Also, this type of education helped us to get instant feedback and results. Also, there are many opportunities we can target in the near future. For example, we can focus on designing a competency-based blended education rather than a knowledge gaining. Also, we can think of some external partnership for a blended education in terms of hospital and in terms of hospital or didactic lectures. Okay, so however, there's some weakness that we have to mention. For example, the internet was a serious weakness, also lack of plagiarism tools, and also lack of some students' commitment to the blended education system, and still competency assessment still not in its optimum form. There are some threats we have to face. For example, so internet connections are unreliable in or during the exam periods. Some students are exchanging their username and password, so we are still in need of robust security measures for blended education. Also, during the blended sessions, there are some distractions like the chat and side talks available on Zoom system. Next, please. I know I'm running out of time, but I'm going fast. So here are some opinion for our staff. So the first faculty has seen that the digital education is much easier and looks better. Another one think that the evaluation via Moodle is so general, and the students were overwhelmed by the very frequent quizzes. A third faculty stated that the invigilation or the proctoring, the virtual proctoring is not well controlled, and there was a rejection for the software of room scanning and the student scanning during exam period. Next, please. So what we learned from the pandemic experiences. So we can say that the theoretical teaching can go fast and go smoothly virtually. However, we need strong internet and electronic platforms to be well established in advance. Hands-on practice and clinical training of students should never be replaced by 100% online assessment. Although I know this might be very challenging during the pandemic period. Next, please. So we are in need for the health authorities and educational authorities to establish and ensure minimum standards to guarantee the quality and competency of students and healthcare providers who are graduated during the crisis periods and emergency periods. Also, we are in need to efficient partnerships to develop and enhance our virtual capacity for a better pharmacy education based on competency-based learning and skill-based learning rather than knowledge-gaining experience. Next, please. So as during COVID era, as staff members, we were exposed 24 hours per 7 to the students. So we need psychological and emotional support system, especially during the crisis periods. Next, please. So I can say that still there are some lack of data about the financial aspects of the capacity building and the different blended learning systems and outcomes. Also, we might need some more research about the quality of teaching and the quality of assessment of blended education models. Meanwhile, we have to keep in mind the potential root of plagiarism. Next, please. So to wrap up, I can say that pharmacy education becoming more technology-based so far with the COVID has escalating this digital transformation. However, we can see that some students still had resistance to the sudden and rapid changing learning environments and conditions. Blended education might be a very potential solution in comparison to the traditional way of learning. Next, please, and thank you very much.
Thank you, Saif, for this informative session. Hanan, we already extended our time, so I thank all our speakers who are still staying with us. I've checked the Q&A box, and there are some questions. And we could. There's a comment from Webrot saying that it's been very insightful. Similar experiences in Zambia. Also, Kamal is asking a question, but I'm not sure how relevant it is. If you have any questions, please feel free to use the Q&A box. We will be here for at least 5 more minutes. Saif, would it be okay for you to pick up those questions while we're still here?
Go ahead, yeah. Go ahead.
Thank you. And dear participants, if you have any further questions, please do not hesitate to contact aim@fifth.org, and we will send the questions to our speakers and contact them and ask for their support to answer your questions. And to wrap up, we could hear from our co-chairs from today. Just a few minutes, please, to your insights and opinions about today. Thank you.
I would like to thank Brian again and Jennifer, Alan, and Saif. The presentation was very inspiring. It touched on several points about maybe about the challenge we all had about the virtual assessment and the challenges and the exam integrity. We moved to sharing the best practices in USA, and finally the other side of other point of view from Saif, the challenges we have in Africa. Please, Lillian, would you go on?
Yes, I would like to add that we are now very well aware of the opportunities of remote education. And probably now we have to move on to personalize those opportunities depending on the area that we're involved in. Most of the experiences today shown a lot of experience on the pharmacy practice and experiential point of view. There are other experiences also from labs and the technology. So we need to personalize into our education program and also into our institutional process. And that is where now we are going to be taking up the message from today and applying it to our experiences, opening up to this is a start of sharing experiences and opening up to future networking also from the leadership positions. That is how I see it. And I'd like to thank all the speakers for sharing their examples.
Thank you, Hanan and Lillian. With these powerful messages, we will wrap up today's episode. I would like to sincerely thank our moderators, Hanan and Lillian again, our speakers, Brian, Alan, Jennifer, and Saif, and also joining us today, the FAME chair, Pierre Moreau, and our valued participants joining us from all around the world. It's been very informative session with you. We have some announcements to make before we close the webinar today. We are excited to invite you to 18th FIP World Congress of Pharmacy and Pharmaceutical Sciences in Seville, Spain. The Congress will take place from 18 to 22 September 2020 under the theme Pharmacy United in the Recovering of Healthcare. Registration and abstract submissions are already open. Here are the important days. For more information, check our website from here. Also, another great meeting that will take place in Netherlands, FIP Pharmacy Practice Research Special Interest Group Summer Meeting will be held in person on 4th and 5th July 2022 in Utrecht University of Applied Sciences. All PhD students and their supervisors, researchers, academics, professional organizations, and practitioners involved in research are welcome to join. You may scan this QR code and book your place now. With that said, I would like to thank you for attending. And thank you very much for joining us today. Stay safe, healthy, and please contact us at aim@fip.org if you would like to become a FIP